Hello, this is Dr. Do again. This video is continuously from previous video, a systemic approach of medicine, talk about the clinical presentations and clinical symptoms associated with different level of the body, from the major organic compounds and their metabolism and diseases, and to the cellular level, and also to the tissue level, talk about the 4 major tissues and associated diseases. And then move on to the organ system levels. I talk about the diseases associated with the skin, which is the integumentary system, and also skeletal muscular system, such as joint problem or myositis, etc. And also move on to the other systems, talk about the respiratory system. I mentioned some common clinical presentations, for example, chest pain or dyspnea caused by the respiratory causes and also the cardiovascular causes. Today I'm going to talk about the edema that is caused by the cardiovascular diseases, the cardiac cause of edema. That's probably the right way to put it. And I had a previous video on edema, just very superficial, because covered broad from the kidney causes, from the nutrition-wise, and also mentioned the cardiac cause. But today I'm just going on focus on the cardiac cause, the edema, and also probably go deeper about the body fluid and the edema, how it happened, particularly for how it happened when there is a heart disease. So, having said that, what are the typical edema refers to, the medical term is referring to the fluid accumulate in the interstitial spaces, which means among the cells, between the tissues, or inside of the tissue. So that's what, between the cells, that's the edema called, the definition, actually, the explanation. And also there is some different kind of edema. It could be the fluid accumulate in the cavities. That's not edema, that's just the fluid, either pleural fluid or pericardial fluid. But this edema referring to the interstitial space, not those existing space. So this is there are pitting edema and there's a non-pitting edema. What that means when you press it, if you feel your leg swelling, you press it. If there's a pitting, that means pitting edema, and if it's not, then it is not. So there are different causes for this edema. Like I mentioned previously, the kidney is one of the major causes. Nutrition, hypoalbumin, decreased albumin in the blood, or decreased protein, hypoproteinemia, probably that's the word. And also metabolic, for example, the hypothyroidism also can cause edema, just in different form, different term. But I'm talking about the edema caused by the heart. How the edema occur in terms of mechanism, the body fluid is regulated among the blood vessels. We know the blood vessel, which is the, and also the cellular fluid, extracellular fluid, intracellular fluid. So this edema basically referring to the extracellular fluid, but not in the blood vessel. That's just the explanation of what is interspatial referring to. So the fluid either across the blood vessel or across cell membrane, really regulated by the many factors. The first of all is there are different kind of pressures, like a static pressure versus the on top pressure. The static pressure from the blood vessel, and also the oncotic pressure from the blood vessel, and also from the interstitial space. So basically, there's a force of the balance. If the oncotic pressure is driving the fluid to the blood vessel, and the static pressure is to push the fluid outside of the blood vessel, and also the same idea occurring in the tissue. So this is because of this pressure balance disturbed. That is the cause for edema. Either increase the static pressure in the blood vessel, that can cause edema, or decrease oncotic pressure from the blood vessel, or decrease the static pressure in the tissue. So these are the balance, how the fluid maintaining in the blood vessel from leaking out to the interstitial space. That's why normal people do not have the edema. So the cardiac cause basically is in the increased static pressure in the blood vessel. That's a major cause to push the fluid out. So that's the major mechanism cause the edema in cardiac cause. What are the, in terms of diseases, what are diseases can have this? Increase the static pressure, cause this edema. In terms of cardiovascular system, cardiac cause, basically I think one of it is just the heart failure, which means the heart cannot pump the blood. At the same time, the heart has the vacuum effect to draw the fluid back to the atrium. If the heart lost this capacity either from AFib or either from the ventricular failure or left or right, I'm talking about if systemic edema, that's probably the right heart. So that means the blood cannot draw back from the right atrium to the right atrium. Increase static pressure in the blood vessel, that's push the fluid out. And because I mentioned that all the systems are connected to each other, if the heart really undergoing this process and the other system like endocrine system, the renal system will respond correspondingly. So then these three major factors together cause this edema. And then in terms of the other causes of this edema I mentioned previously, but it's not cardiac cause. For example, if you decrease the oncotic pressure, decrease the protein in the blood vessel, but I'm focusing on the really is the heart failure and AFib or the heart failure cause the edema. So usually if this is the cause, and this is the right side heart failure instead of left side, so the generalized edema. And then usually compared to the left side heart failure, it's a pre-stage. Eventually, if not corrected on time, will trigger the left or the whole heart failure. So having said that, if you had previous conditions, particularly if you have lung disease, this is talk about the connections of different systems. If you have the long-term COPD, develop the pulmonary, that's one of the major cause for the systemic edema caused by the heart failure, the right side heart failure. Or you have liver diseases also can cause this right side of heart failure. In terms of management, I think first of all you need to see your physician, evaluate thoroughly whether it's left or right, whether there's any other causes. In addition to the targeting or focusing on the cardiac cause, like I mentioned, all the other systems are involved. Even though the original cause is cardiac, could at the same time complicate it already, impaired the other system function, like kidney, for example. So the first taking home message for this video is, if you had this edema, definitely do not think, oh, it's going to go away. If there is some, particularly if you're not young, I really recommend you get it checked, see your physician, to do whole workup to exclude any causes like the nutrition-wise or the cardiac or the kidney or endocrine, etc. And then in terms of management, your physician will manage accordingly. For the cardiac cause, the edema, usually the diuretics, just get them out. That's the major management, and also treat the original diseases. For example, if it's a pulmonary, then treat the lung condition, give oxygen, etc. So I'm going to stop here, and I hope it helps. Thank you for watching. I'll see you next time.